Good morning, friends, or good afternoon, friends, from wherever you are watching. Today, we are going to be talking about schizoaffective disorder, what it is, what is happening, and what do we do for it. So, schizoaffective disorder is relatively a new concept that a lot of people deal with and have been dealing with for generations and generations, but we didn't have a good name or understanding of it. So basically, schizoaffective disorder is, the way I describe it is if schizophrenia and bipolar had a baby and it blends the two completely. So this is for people that experience both psychosis, such symptoms that are in schizophrenia, like delusions, which would be believing things that aren't true or there's no proof for, hallucinations, so hearing, tasting, feeling, smelling, or seeing things that maybe other people can't. And then the opposite side is the bipolar symptoms. So these are mood disorders. So the mania of feeling really excited and really up there, or being on the other side of the depression, feeling really, really low, lack of motivation, lack of energy, sadness, all of those things. So basically, when somebody experiences schizoaffective disorder, they're experiencing all of these things together. And so that can make for kind of a difficult thing to manage. And so when we look at someone who is experiencing these symptoms, we oftentimes end up, or providers and psychiatrists out there end up kind of just throwing different medications that treat this symptom and this symptom. We've got antipsychotics that treat the psychosis part of it, and then we've got antidepressants or mood stabilizers that treat the other side of things. And what ends up happening is people with schizoaffective disorder have all of these medications in their cabinet that feel too much and, have different health limitations. They could go through our liver, and just too many medications can already be difficult to handle when we're already trying to handle the symptoms and side effects of what's going on with having this disorder, which is already hard enough as it is, right? And so when we're looking at treatments, we've got something called Invega Sustenna. And Invega Sustenna is a paliperidone palamate. And so what that does is that is the key ingredient in Invega Sustenna. But what is the neat thing about Invega Sustenna is that this is a once a month injection, which means you can eliminate all of the pill boxes and all of the managing and remembering, oh, did I take it? Did I not take it? All of that's gone, because once a month you can go and get an injection either in your arm or in your hip, and that's it. And the best part about it is that the Invega Sustenna treats both the mood management and the psychosis, which means that you don't have to have multiple medications for this one symptom. And so the best part is too that Invega Sustenna has actually been growing, and you can start with a once a month, then move to once every 3 months with the Invega Trenza, and then move to the Invega Hafura, which is every 6 months, which means 2 shots a year to manage your symptoms and go on and move on and live your life. That sounds like a deal, right? The best part is that 85% of patients remained relapse-free after 15 months. And what relapses are these are the psychotic hospitalizations, the crises, the suicidal or homicidal behaviors, and any worsening side effects. 89% did not relapse due to their mood symptoms, and then 87 did not relapse due to the psychotic symptoms. And this is out of 725,000 people in America who have schizoaffective disorder could be receiving this treatment. And so that is just something so exciting of think of all the lives that could change. And you could grow and move on and have families and have jobs and careers and whatever it is, travel, do whatever it is that you want to do in life. And so in the study, based upon Johnson & Johnson and the InVegaSustentaEffective.com, where we can get all of this information, we can learn about the different studies and side effects. Unfortunately, like every medication, there is side effects. I will say that I firsthand treat clients who are on this injection or on a variation of the injections, and I have seen immense life-changing things happen for people. I've had people who hear voices, and a year later, I have seen them no longer hearing voices, getting a job, and this is going from being unhoused with no supports to all of a sudden having friends and living a full life with goals and ambitions, which is so exciting to see. Some of the things that can happen are things like tardive dyskinesia, and this is a involuntary movement. A lot of times it appears in things like our legs shaking, hands tremors, and involuntary face movements. And this can happen with your jaw, and it can be really tiring. But the best news is that we, with the combination of Parkinson's medications, can control those to where they're barely even there. Some other things to consider is this is for adults. And so adults out there with this diagnosis, this isn't a diagnosis that's typically given to children or adolescents anyways. But one thing to be cautious of is if you are an elderly member, this is about 65 or older, being conscious of if you have a history of dementia or strokes or any cardiac situations. This would be something to double, triple check with your doctor to make sure that you're not at risk for making it worse, because this medication can affect our cardiac systems. Okay. And then, of course, we all have different religious and cultural beliefs and backgrounds, and that this is something to absolutely take into consideration, especially for those who experience psychosis. We can feel that we can touch a different world, and we have this access to things that maybe others don't. And it might be nerve-wracking to feel like you want to try something to shut off that world, and to where you no longer have access to that extraterrestrial spiritual world. And that's something that you should talk to your family and your friends and your support, and maybe a pastor or a priest of some sort, some spiritual leader, to kind of guide you through what that looks like, and if that fits you best. Something else is there are limitations of maybe the medication not being natural, and that can be really nerve-wracking at first. And so I would encourage you to look into deeper what the medication is and what it's made from and what it's for and how it interacts in our body, because it is a very intricate and really unique situation. And sometimes our family and friends are going to be skeptical, and that is okay. And that is something that I'm happy that people have access to. And I encourage you to talk to your friends and family and look at how this is going to affect not only you, but the people around you. And so paliperidone, Palamate, is such a unique opportunity to treat schizoaffective disorder, not just treating the psychosis or the mood, but treating both of them hand in hand, because it's a unique situation and it is something that deserves to be treated, because so many people are out here suffering, and they don't have to. So I encourage you to look into it and talk to your doctor about if this is a good fit for you.